Hi, my name is Dr. Megan Cardoso. I work at Chelmsford Pediatrics and I've been practicing since 2011. I'm here today to talk about the top 3 things you need to know about kids with COVID. The first thing that we wanted to talk about today is that school is safe. So there have been lots of changes as kids are going back to school. There are things like social distancing, there's masks, lots of hand washing, which is different. But there's lots of research out there that has shown us actually that it's very safe for kids to go back to school. We have learned that in the same ways that COVID has shown us inequities in healthcare, that it's happening in schools as well. There are kids who don't have proper internet or Wi-Fi at home. There are kids who don't have enough to eat at home. And so getting kids back to school is not only good for their education, it's good for their life in general. It puts them back on a level playing field. The second thing that we should know about kids is that they can be spreaders. Often children are asymptomatic or have very mild symptoms like a runny nose or a cough, and they actually have COVID. The good news is that they often don't get as sick as adults or grandparents, but it's important that we follow our pediatricians and the CDC's advice to get tested and to quarantine for the appropriate amount of time. The third thing to know about COVID is cardiology clearance after you have COVID for sports. So if your child has had COVID and they play sports, it's important to get in touch with your pediatrician. Often it's just a quick visit to check the heart and make sure things are going well. But if your child had a more severe course with longer fevers and more severe symptoms, sometimes they'll need an actual cardiologist to do clearance to go back to sports. We know that getting a COVID vaccine is a personal decision. If you have questions about your children getting the COVID vaccine, you should call your pediatrician.